Governor Bill Lee is giving a media briefing right now. It started just moments ago. We're on your side with live coverage out of Nashville.
We also are grateful for those on the ground who are helping in the effort, first responders from even other counties that responded there. Commissioner Schwinn is on the ground in Meigs County today to offer support from the state and the Department of Education, but most importantly, we stop to remember and to acknowledge and to offer our prayer and support to our neighbors. A tragic situation on the ground. Also, there's a critical need in the community for blood donations in that area. There is an organization there called Blood Assurance that has centers in Chattanooga, in Cleveland, in Hickson, in the Gun Barrel area for donations of blood. And we encourage those in that region to go to the website for Blood Assurance to find out where it is that they can help and that they can make donations of blood for that hurting community. Maria and I are done with our exposure, have completed our 14-day exposure. We're very fortunate that we did not fall ill as a result of our exposure. We do believe that quarantine period was important, but we're also very grateful to our staff and our detail who wore masks when they were with us, and that is the reason that we did not contract the virus. We wore masks, they wore masks, and it's a reminder to all Tennesseans that masks are a very important part of this comprehensive strategy that we have to fight COVID in our state. I've invited a partner of ours, Dr. Wendy Long with the Tennessee Hospital Association. She will be making remarks in a few minutes. The THA has been an incredible partner with us throughout this pandemic, and we want to make sure that she has an opportunity to express what's happening with our providers across the state to address the hospital capacity as we address the growing case rates in our state. It's important to keep in mind that we are, in fact, in a period of time where our case counts are growing across Tennessee. In fact, as we all know, that's happening in the vast majority of states across the country. And we experienced a similar surge to this in the summer. We have gone beyond the numbers of that particular surge, but we were reminded in July when we had a significant case count, just like we're reminded today, that it is important that we each recognize what's happening around us and take the personal responsibility and make the decisions that are important for all Tennesseans to make to help protect ourselves and our neighbors in the midst of a growing pandemic currently in our state. Due to the surge in cases, many of our county mayors, a number of them just in the last several days, have implemented mask requirements in their communities. Many are considering it. We've had a lot of conversations with those mayors. As of now, about 62% of our population is currently under a mask requirement, and many of those decisions have been made in the last few days and are continuing to be made in the coming days. So we believe that targeted strategy is a good one, and it's working. I want to commend the mayors who are both considering and those who have made a decision to go that direction, understanding that masks are a very important part, and the adherence of that and the strategy for that adherence is very important to all of us. As we near the end of the month, I'll be extended the state of emergency that will allow those mayors to continue that strategy, but also it allows much needed federal funding to continue to come into our state. It allows for remote virtual meetings for local elected officials and a number of other things that go along with that extension. And we'll be talking more about that at the end of the week as that approaches. Dr. Long, if you would please come up, let's begin to talk a little bit about our hospital capacity, and we'll move more into the health side of our report.